NCLEX Q&A Daily Practice. Part 9. 21. A child and his family were exposed to Mycobacterium tuberculosis about 2 months ago. To confirm the presence or absence of an infection, it is most important for all family members to have A. Chest X-ray. B. Blood culture. C. Sputum culture. D. PPD intradermal test. 21D. PPD intradermal test. The administration of the PPD intradermal test determines the presence of the infection with the Mycobacterium tuberculosis organism. It is effective at 3 to 6 weeks after the initial infection. 22. A client comes into the community health center upset and crying, stating, "I will die of cancer now that I have this disease." And then the client hands the nurse a paper with one word written on it, pheochromocytoma. Which response should the nurse state initially? A. Pheochromocytomas usually aren't cancerous, malignant. But they may be associated with cancerous tumors in other endocrine glands such as the thyroid, medullary carcinoma of the thyroid. B. This problem is diagnosed by blood and urine tests that reveal elevated levels of adrenaline and noradrenaline. C. Computerized tomography, CT, or magnetic resonance imaging, MRI, are used to detect an adrenal tumor. D. You probably have had episodes of sweating, heart pounding, and headaches. 22A. All of the options are correct information. The best response of the nurse is to address the issue presented by the client: fear of cancer. Pheochromocytomas may release large amounts of adrenaline into the bloodstream after an injury or during surgery. For this reason, they can be life-threatening if unrecognized or untreated. 23. On admission to the hospital, a client with an acute asthma episode has intermittent non-productive coughing and a pulse oximeter reading of 88%. The client states, "I feel like this is going to be a bad time this admission. I wish I would not have gone into that bar with all those people who smoked last night." Which nursing diagnoses would be most important for this client? A. Anxiety related to hospitalization. B. Ineffective airway clearance related to potential thick secretions. C. Altered health maintenance related to preventative behaviors associated with asthma. D. Impaired gas exchange related to bronchoconstriction and mucosal edema. 23D. Impaired gas exchange related to bronchoconstriction and mucosal edema. Pulse oximetry reflects oxygenation of arterial blood. While the other diagnoses may be appropriate for this client, they are not the most appropriate priority at the time of admission. 24. A newly appointed nurse manager is having difficulties with time management. Which advice from an experienced manager should the new manager implement initially? A. Set daily goals and establish priorities for each hour and each day. B. Ask for additional assistance when you feel overwhelmed. C. Keep a time log of your day in hourly blocks for at least 1 week. D. Complete each task before beginning another activity in selected instances. 24C. Keep a time log of your day in hourly blocks for at least 1 week. Apply the nursing process to time management, so the assessment of the current activities is the initial step. A baseline is established for activities and time use so that needed changes can be pinpointed. 25. The nurse is caring for a 4-year-old child with a greenstick fracture. In explaining this type of fracture to the parents, the best statement by the nurse should be that A. A child's bone is more flexible and can be bent 45 degrees before breaking. B. Bones of children are more porous than adults and often have incomplete breaks. C. Compression of porous bones produces a buckle or torus-type break. D. Bone fragments often remain attached by a periosteal hinge. 25B. Bones of children are more porous than adults and often have incomplete breaks. This allows the pliable bones of growing children to bend, buckle, and break in a greenstick manner. A greenstick fracture occurs when a bone is angulated beyond the limits of bending. The compressed side bends and the tension side fails, causing an incomplete fracture. 26. While caring for a client with infective endocarditis, the nurse must be alert for signs of pulmonary embolism. Which of the following assessment findings suggests this complication? A. Positive Hohmann sign. B. Fever and chills. C. Dyspnea and cough. D. Sensory impairment. 26C. Dyspnea and cough. Vegetation from the infected heart valves often leads to pulmonary embolism in the client with infective endocarditis. Cough, pleuritic chest pain and dyspnea are early symptoms. 27. The nurse uses the DRG, Diagnosis Related Group, manual to A. Classify nursing diagnoses from the client's health history. B. Identify findings related to a medical diagnosis. C. Determine reimbursement for a medical diagnosis. D. Implement nursing care based on case management protocol. 27C. Determine reimbursement for a medical diagnosis. DRGs are the basis of prospective payment plans for reimbursement for Medicare clients. 28. The nurse would teach a client with Raynaud's phenomenon that, after smoking cessation, it is most important to A. Avoid caffeine. B. Keep feet dry. C. Reduce stress. D. Wear gloves. 28A. Avoid caffeine. The most important teaching for this client is avoid caffeine after stopping smoking. The question is asking what is the most important teaching. The other approaches tend to be needed less frequently and so are less of a priority. 29. A client returned from surgery for a perforated appendix with localized peritonitis. In view of this diagnosis, how would the nurse position the client? A. Prone. B. Dorsal recumbent. C. Semifowler. D. Supine. 29C. Semifowler. The semifowler position assists drainage and prevents spread of infection throughout the abdominal cavity. 30A. Bradycardia. The most common sign of digoxin toxicity in children is bradycardia, heart rate below 100 bpm in an infant. 30. 4-month-old child taking digoxin, Lanoxin, has a blood pressure of 92/78, resting pulse of 78 bpm, respirations 28 and a potassium level of 4.8 milliequivalents/L. The client is irritable and has vomited twice since the morning dose of digoxin. Which finding is most indicative of digoxin toxicity? A. Bradycardia. B. Lethargy. C. Irritability. D. Vomiting. 31. The hospital is planning to downsize and eliminate a number of staff positions as a cost-saving measure. To assist staff in this change process, the nurse manager is preparing for the unfreezing phase of change. With this approach, the nurse manager should A. Discuss with the staff how to deal with any defensive behavior. B. Explain to the unit staff why change is necessary. C. Assist the staff during the acceptance of the new 31B. Explain to the unit staff why change is necessary. The first phase of change, unfreezing, begins with awareness of the need for change. This can be facilitated by the manager who clearly understands the need and stands behind it. The phase is completed when staff comprehend the need for change. 32. Which of these statements by the nurse is incorrect if the nurse has the goal to reinforce information about cancers to a group of young adults? A. You can reduce your risk of this serious type of stomach cancer by eating lots of fruits and vegetables, limiting all meat, and avoiding nitrate-containing foods. B. Prostate cancer is the most common cancer in American men with results to threaten sexuality and life. C. Colorectal cancer is the second leading cause of cancer-related deaths in the United States. D. Lung cancer is the leading cause of cancer deaths in the United States. Yet it's the most preventable of all cancers. 32A. It is recommended that only red meat be limited for the prevention of stomach cancer. All of the other statements offer correct information. 33. the nurse and a student nurse are discussing the specific points about infants born to HBsAg-positive mothers. Which of these comments by the student indicates a need for clarification of information? A. The infant will get the hepatitis B vaccine and the hepatitis B immune globulin within 12 hours at birth at separate injection sites. B. The second dose can be given at 1 to 2 months of age. C. The third dose should be given at least 16 weeks from the second dose. D. The last dose in the series is not to be given before age 24 weeks. 33C. The third dose should be given at least 16 weeks from the second dose. The third dose is to be given 16 weeks from the first dose and 8 weeks from the second dose. All of the other options are correct information. These infants will also need to have the blood tested for hepatitis titers and antibodies between 9 and 15 months. 34. A female client diagnosed with genital herpes simplex virus 2, HSV2, complains of dysuria, dyspareunia, leukorrhea and lesions on the labia and perianal skin. A primary nursing action with the focus of comfort should be to A. Suggest 3 to 4 warm sitz baths per day. B. Cleanse the genitalia twice a day with soap and water. C. Spray warm water over genitalia after urination. D. Apply heat or cold to lesions as desired. 34A. Suggest 3 to 4 warm sitz baths per day. Frequent sitz baths may soothe the area and reduce inflammation. The other actions are correct actions, however, they would not address the entire group of findings. 35. The nurse manager has a nurse employee who is suspected of a problem with chemical dependency. Which intervention would be the best approach by the nurse manager? A. Confront the nurse about the suspicions in a private meeting. B. Schedule a staff conference, without the nurse present, to collect information. C. Consult the Human Resources Department about the issue and needed actions. D. Counsel the employee to resign to avoid investigation. 35C. Consult the Human Resources Department about the issue and needed actions. To avoid legal repercussions, the nurse needs to consult with the Human Resources Department for proper procedure for documentation, counseling and available resources. The employee may be protected under the Americans with Disabilities Act. 36. A client has been admitted for meningitis. In reviewing the laboratory analysis of cerebrospinal fluid, CSF, the nurse would expect to note A. High protein. B. Clear color. C. Elevated SED rate. D. Increased glucose. 36A. High protein. A positive CSF for meningitis would include presence of protein, a positive blood culture, decreased glucose, cloudy color with an increased opening pressure, and an elevated white blood cell count. 37. A client with chronic congestive heart failure should be instructed to contact the home health nurse if which finding occurs? A. Weight gain of 2 pounds or more in a 48-hour period. B. Urinating 4 to 5 times each day. C. A significant decrease in appetite. D. Appearance of non-pitting ankle edema. 37A. Weight gain of 2 pounds or more in a 48-hour period. It is critical for clients to report and be treated for rapid weight gain, decreased urinary output, worsening nocturnal orthopnea, pitting ankle edema, and other findings of chronic heart failure. Hospitalization may be avoided with early intervention. 38. A 74-year-old male is admitted due to inability to void. He has a history of an enlarged prostate and has not voided in 14 hours. When assessing for bladder distension, the best method for the nurse to use is to assess for A. Rebound tenderness. B. Left lower quadrant dullness. C. Rounded swelling above the pubis. D. Urinary discharge. 38C. Rounded swelling above the pubis. Swelling above the pubis is representative of a distended bladder in the male client. 39. With an alert of an internal disaster and the need for beds, the charge nurse is asked to list clients who are potential discharges within the next hour. Which client should the charge nurse select? A. An elderly client who has had type 2 diabetes for over 20 years, admitted with diabetic ketoacidosis 24 hours ago. B. An adolescent admitted the prior night with Tylenol intoxication. C. A middle-aged client with an internal automatic defibrillator and complaints of passing out at unknown times. Admitted yesterday. D. A school-aged child diagnosed with suspected bacterial meningitis and was admitted at the change of shifts. 39A. This client is the most stable and has a chronic condition. Tylenol intoxication requires at least 3 to 4 days of intensive observation for the risk of hepatic failure. The other clients would be considered unstable. 40. Which one of the following statements, if made by the client, indicates teaching about Inderal, propranolol, has been effective? A. I may experience seizures if I stop the medication abruptly. B. I may experience an increase in my heart rate for a few weeks. C. I can expect to feel nervousness the first few weeks. D. I can have a heart attack if I stop this medication suddenly. 40D. I can have a heart attack if I stop this medication suddenly. Discontinuing beta blockers suddenly can cause angina, hypertension, dysrhythmias, or an MI.